So first, a simple anatomy review. We have our otolithic organ here, with this side dealing with balance, and this side, the cochlea, dealing with hearing. So most importantly, I want to focus over here at the semicircular canals. The three main canals are a horizontal semicircular canal, an anterior semicircular canal, and a posterior semicircular canal. These semicircular canals are important in our balance because they detect angular and rotational changes. The fluid in these canals will shift, sending signals to our vestibular cochlear nerve to the brain that will tell us, hey, we're moving, adjust the body accordingly. Let's go over a couple of eye movements that you'll see with these different disorders. First eye movement we're going to go over is called smooth pursuit. It allows the eyes to follow a slow moving object. So for example, if you're watching a bird fly across the sky. To test this, you will take your finger and have the patient watch your finger while keeping their head still. Second type of eye movement are saccades. These allow your eyes to quickly move to find a target. For example, if someone calls your name, you turn and look to find the person who called your name. To test this, have two objects like your fingers, and the patient's gonna keep their head still and switch their eyes from looking at your first finger and the second finger. The next type of eye movement is convergence. That allows your eyes to follow something at the midline of your visual field. So for example, if I hold out my thumb and I look at my thumb and I move it close to my nose. The last type of eye movement, or really reflex, that we're going to talk about is your VOR, vestibular ocular reflex. This is really important when it comes to peripheral vestibular disorders because sometimes you'll find a deficit in your VOR. Your VOR is what helps you keep an image on your retina. To test for this, have a patient look at one object and shake their head no, while maintaining focus on that one object in front of them. Let's go over the difference between central and peripheral vestibular disorders. Some examples of central vestibular disorders might include an intracranial tumor, a stroke, or a TIA. As far as peripheral disorders, the most common one is BPPV. Others might be Meniere's or semicircular canal dehiscence. The next component we're going to look at is nystagmus. Nystagmus is the involuntary eye movement that you can have with some of these disorders. When it comes to central disorders, it's almost always going to be a downbeating nystagmus. As far as peripheral disorders, most of the time it will be upbeat and torsional nystagmus, or sometimes it will be horizontal nystagmus. Another component of nystagmus is the speed of which the eye twitches. In peripheral disorders, it's always going to be a fast and then slow motion, fast then slow. With central disorders, they will be at equal speeds. The last component of nystagmus is about positional changes. Sometimes nystagmus is brought on when your head is put into a particular position. This is very common for peripheral disorders, that it is invoked with a positional change. However, with central disorders, you do not need to position your head in order to provoke nystagmus. It can occur spontaneously. As far as smooth pursuits and saccades, these will appear normal in peripheral disorders. However, in central disorders, smooth pursuits and saccades will be abnormal. When it comes to central disorders, the main test they use is called HINTS plus, stands for Head Impulse Test of Skew plus hearing loss. And then as far as peripheral disorders, there's multiple depending on the semicircular canal, and those consist of Dix-Hall-Pike, supine roll test, and straight head hanging position. So how do you treat them? For central disorders, refer out. As far as peripheral disorders, that's something we can treat, and depending on what it is, it can be anything from a modified Epley, which is a canalith repositioning maneuver, as well as a horizontal log roll and other tests. If you're interested in pursuing some of these canalith repositioning maneuvers, please click the link below in the description. There's an entire playlist for BPPV treatment and diagnostic tests for those.